My grandfather went to dental school in 1898 when it was all about extracting. How well can you take a tooth out? Because they didn't have anesthesia. And I heard two old guys talking in Lawrence, Kansas at the coffee shop. And he said, that old Bert Kennedy, he can slick a tooth out of your head before you even know it. And I was a little distressed by that because I thought he ought to be saving teeth. And so I saved way too many teeth. And then I discovered belatedly, thanks to the work of this academy and others, that root canals are terrible. And so stop the gum disease, keep the teeth, don't kill them with mercury fillings, and then you'll be a preventive dentist. And so you're, Lord knows what you're going to prevent, but it's going to be a really good thing because we can cause a lot of problems. One of the problems that we cause is because of our ignorance of toxicology. Is it the only toxicologist that is taught in the dental school in the United States in the last 100 years was Phyllis Mullinex, and that she was recruited from the Boston Hospital for Children, a toxicologist. She went to KU, yeah, rock chalk, and but they knew she was knowledgeable about toxicology, and they recruited her to study mercury and fluoride, and that she was there for 14 years and hadn't got around to studying fluoride, hadn't got around to studying mercury, but then Pam Denbeston poisoned some rats with just enough fluoride to cause just a little dental fluorosis. Rats are really tough. It's really hard to cause dental fluorosis, so they gave them just enough to cause just very mild dental fluorosis. And Phyllis put these rats into a very sophisticated computerized observation. So rats only do about 4 things. You know, if they hear a door slam or something, they'll get up on their back legs and kind of check around and say, who slammed the door? And, you know, they'll groom themselves. And, you know, 3 or 4 little behaviors, and you can teach a computer to watch that. And what she found was that Pam Denbeston's rats with a little bit of dental fluorosis were impaired. They would, a door would slam, they'd get up, and they wouldn't look around. They'd just sit back down and forget why they stood up. They'd start grooming and stop. They didn't do the whole job. They were bozo rats, and so we have a country of bozo people. So if you have trouble with drivers on the road, you say, you've been brushing with a fluoridated toothpaste again, haven't you? So what we have is a profession that is devoted to materials, not the art of healing, not the art of well-being, how to make people as healthy as they possibly can be, but we've become enamored with materials. Where's Madonna and her material girl? The material profession. Who cares what kind of materials you use? It doesn't make any difference if the patient is well, right? So Calgary, Canada, those Canadians have been knocking fluoride out faster than the advocates can put it in. They went from 70% fluoridated about 10 years ago to 30% now. And that's causing a great deal of consternation among the companies that have hydrofluorosilicic acid to get rid of. And so what they do is they enlist the aid of dentists to come lie to the public about what's going on. And so here's a nice article, more tooth decay after city cuts fluoride in the water. Do you think that's true? My goodness. Let's go look and see what why did Calgary cave to the chemophobes, or I've been called a fluorophobe, or why did they do that? And it needs to drop the conspiracy theorists. Oh, badmouth us. You know, when somebody starts calling advocates for health bad names, look and see who's paying that person to talk, because nobody's paying me to talk. So who's paying them to badmouth me? And I even have bots on my website. I have a YouTube website that has 25 documentaries on it. Everything I know is already there. But I get bots that come on, and it says the same thing every time, and it never responds to my response. Real people respond. Oh, doc, I got this terrible toothache. What should I do? Pull it. Doc, I want to keep it. I want to keep it. Pull it. Anyway, so that's a real person. The bots, you can respond all day long. They don't respond to you. Cavities show why Ontario should require fluoride. It's trying to get other people to put it in. And so how much of Calgary's cavities increased Okay, the media has been awash with claims that it is. If this is true, there should be two things. There should be a spike in its tooth decay rate, okay? If this is true, the cavity spike would need to resemble one of the two following patterns. Either A, they stopped fluoridation there, and tooth decay went dramatically up. That's what you'd expect to see if this report were true, wouldn't it? That's something like that. Or you might be like this, you know, that there was a steady increase and then there was a slight, they stopped, and so there was an even greater increase. And you see there's another city above them, Edmonton. Edmonton is colder than Calgary, so maybe cold causes tooth decay because Edmonton has higher tooth decay anyway. So dentists are not well trained in science. They do know how to say, what is it about association does not equal causation. So associated with cold doesn't mean that the cold is causing that. So using the same logic as a dentist, oh, tooth decay's gone down in the last 50 years. It must have been because of the fluoride. And I say, well, television screens have gotten a lot bigger in the last 50 years. It must be because of fluoride. And they say, well, that doesn't follow. Well, neither does yours. Except the fact that they do use fluoride in the lenses of the television. So it maybe has to do with, they can build bigger lenses now because of fluoride. I was wrong, okay. And so that the study did not provide data to answer these questions because it used only 2 surveys. So how do they cheat? They cheat by selecting the data they show the profession and the public. That is unethical on its base. Is it the profession, every licensed professional has the obligation to tell the truth, and that obligation extends even if they don't know that they're lying. Because you're the professional, you have the obligation to make sure that what you're saying is true, not the public. And so here's the real survey, is that at the beginning they showed this number of 2.6, and then the end they have the 6.4, and then they stopped the fluoridation in the middle. So did it show that? No, didn't show that. Did it show that? No, didn't show that. Here's the omitted data, is that there was another study in the middle that shows that tooth decay has been going up continuously in Calgary from the beginning of this research clear through today. Why? Calgary is an oil drilling company. Poor people have cavities. So if gobs of poor people are moving to Calgary to go drill oil and make $60 an hour, you're going to have them bringing their wives and children. So they didn't make $60 an hour last year, and so they're poor children. And so they're measuring the flux of people through the area. That's not a scientific survey. Where's the double-blind, placebo-controlled, broad-based study showing fluoride had any benefit whatsoever? Don't have them. Oh, it's hard to do. No, it isn't. You can give people 2 jugs of water, one with fluoride, one without, and measure them. They've done that. They found the allergies go up. So now let's revisit theory 2. Ending fluoridation caused decay to exceed the rising background levels and erase Calgary's gap with Edmonton. If true, the spike would look like this. That theory fails also, doesn't it? Is that there was no increase in the incline of the plane. It stayed exactly the same because people have continued to move. Fracking, you've heard, probably a term that you've heard. You know, oil, that's where Calgary is, known for their oil production. So here's your permanent tooth decay survey year 2004, 4.5, 2013, 1.5. Let me ask you this. Isn't 0.15 smaller than 0.45? So why aren't they touting the great drop in permanent tooth decay? Oh, that doesn't support the idea that we need to add hazardous waste to the water supply for the kiddies. But if you don't dig into these studies and pick them apart piece by piece, you could be fooled, as most of our profession has been. The Edmonton is still above Calgary in permanent tooth decay. What do you care, baby teeth or permanent teeth? Who has baby teeth? Babies. So if you look at the time frame, these babies have got nothing, their cavities have nothing to do with the cessation of fluoridation in Calgary. And that it's, now here's the prenatal fluoride exposure and cognitive outcome of 4 and 6 and 12 ages in Mexico. And what kind of study, what kind of person would do this kind of study? Oh, that would be a neurologist. M-O-R-T-E-Z-A, Morteza Bachan. So if you look, there's quite a few names there. And it's because it's a really, really big study. I think it went for 12 years. And they tracked them. They did it in a blinded fashion, collected the numbers, analyzed them. And what they showed was more fluoride, dumber children. So is anybody having trouble getting their kids to go through college? Anybody having trouble doing the coursework in some of the lower levels of school? Do you think it might have to do with the fact that we've overdosed several generations of Americans with a neurotoxin through universal spreading it throughout our food chain? You say, well, you know, this wouldn't happen. The FDA would never approve fluoride drops and tablets, and I know because I prescribed fluoride tablets. I tried one time to prescribe fluoride tablets for my nieces and nephews. I don't have any children of my own, but my brother had 3 children, and boy, we have to protect them from fluoride. And my sister-in-law is a nurse, and she threw the prescription away. And that was before I got smart and read a book. I didn't quit recommending fluoride until 1984. So we don't start out knowing this stuff. But I ran into John Yamianis. I wrote an article about how good fluoride was, and my editor, Roy Cupson, sent it back, and he says, I think you need to rethink your position, and referred me to a good book. I read the good book, and I knew that the biochemist Yamianis knew a lot more about fluoride than I did, and he pointed out all the flaws in the original studies. The original studies weren't blinded. Who's going to mass medicate the entire population of the United States on an unblinded, no control study? Well, that would be our profession. We recommend it, but we've been duped. Just like the study I was showing you before. You could go through, we could spend 2, 3, 4 days going through all of these different studies, and I will show you the holes in every single one. They're all phony baloney. If I asked you to produce for me a single, solitary, broad-based, and that means it's got to have, 39, 40,000 children in it, blinded, which means the investigators couldn't know where the kids were living in a fluoridated community or non-fluoridated community, broad-based blinded study that found a significant, that means instead of the static that you get, a significant drop in permanent tooth decay. Why do I limit it to permanent teeth? Because fluoride causes a delay in the eruption of teeth between the ages of 6 and 8, that in the very first study, Kingston Newburgh wasn't blinded, but we do know that they put fluoride in the water of Newburgh. And so if you examine the 1945 to 55 study, if you examine that study, what you find is the poor little children in fluoridated Newburgh, delay in eruption was as much as 6 months. So what mother do you know thinks it's really good for you to slow down the development of their child? Well, that's exactly what it did. We see it in animals. If you watch one of my documentaries called Poisoned Horses, that Kathy Justice points out that here's this adult horse that still has its baby teeth. Duh, that ain't right. And we showed that happen in humans in terms of tooth eruption. So if you're a liar, what you do is you say, let's focus in on the tooth decay between ages of 6 and 7. Because the kids that have fluoride in their system won't have as many permanent teeth. And so if the most tooth decay in the entire planet occurs in the permanent first molar that's supposed to come in, do you remember when? 6, right. So if we don't let it come in until 6:30, then there will be a slight difference in tooth decay. Is it significant? No. It's just slight enough that they can point to it and then see a difference, woohoo! So when you see investigators trying to narrow your focus down to a little range of time, then you have to wonder, is there a conflict of interest? Do they have an agenda? Why would they focus it on an age when it's really kind of early, isn't it? Aren't we worried about kids when they're 18, 19, 20? Why do we focus it down? Because you know you're going to delay the development of that permanent tooth, so you're going to get a slight notch in your graft. Is it significant? No, it goes away. And that if we allow that to continue, that you will continue to think that Roundup is good for you. Glyphosate is not a problem in your food. Or radiation coming out of the Fukushima Daiichi only makes the fish cook themselves. So we need to reassess our willingness to accept something that somebody said in the front of the room. When I tell you something, I'll give you a reference for it, because I didn't come to these ideas by myself. I came to these ideas by studying the scientific literature, by listening to others who had done the research, and that's the beauty of the academy. You will meet the people doing the research at this academy. Phyllis Mullinex has spoken here twice. Boyd Haley 100 times. The people doing the research are coming to tell us about what they found, and then you have a chance to poke at them. Did you narrow your focus to just 2 days? What else did they find in Kingston, Newburgh? A delayed eruption of the permanent teeth, but an early onset of menses. Do you know what the scientific literature shows about women who begin to menstruate early in life? An increased risk of breast cancer. Well, you can't prove that caused this. No. But I know that if you raised a woman free from fluoride, that her biological clock comes on and goes off like it has for centuries before. But if you expose them to fluoride, you will see this in my China's battle with crippling water. There's a 9-year-old with gobs of dental fluorosis, and she looks like a woman. She's an adult. Why would that happen? What's the mechanism? And you have to thank Jennifer Luke for examining the pineal gland. What's the trigger for menses is the pineal gland. And the pineal gland in people that are exposed to fluoride calcifies. And it's like a trigger. Oh, this person's exposed to a poison that's going to cause them to die young, so they need to breed early. That's all that's about. That's a protective mechanism for the human population. It's got nothing to do with any benefit to the teeth. It's got a lot to do with harm to the child. So we have this study, which is a really well-done study, and it's been followed up with even more. What they did is they measured the urinary output. If you've got decent kidneys, that when you take in 2 molecules of fluoride, 1 will come out in your urine. Well, golly, I can do the math on that. If I get a daily urine, I can measure how much fluoride's coming out. I know what the daily intake is, right? And so what do the pundits say about, oh, it's done in Mexico? They have salt fluoridation, so it's not nearly the same as our water fluoridation. No. And you know, they didn't control for this, that, and one thing, and then whatnot. Read the study. They did. They controlled for everything they possibly could. And, oh, it was just an insignificant amount of drop in IQ. Only 6 points. So you go from being a doctor to a janitor. What the heck? You know, we need janitors. You know, there's stuff on the floor. Get busy, sweep it up. So how can you dismiss that? How could you say that wasn't important? Wouldn't that be shocking, especially if you work for the U.S. Public Health Service and go out advocating for fluoride? You know what happens if you make a noise? You're working for somebody else. They fire you. They use the power of our government, our tax returns. Our industry has bought our government, and our government supports industry. Not you, not me, not our health, not our longevity, not even our children, which is the future of our country, because they have a lot of fluoride to get rid of, because they don't put fluoride in the water. No, that's entirely too costly. We can't put fluoride in the water. We'll put hazardous waste and call it fluoride. were being misled intentionally. And my goal here today is not to teach you about fluoride, not to teach you about this, that, one thing, another. It's to raise your awareness that there are people who will lie to you right to your face, and they will look really good at it. Yes, we've done all these studies, and this arm comes up like this. Watch this. And all those anti-fluoridationists are full of beans, because we know we love your children. We would never do anything to harm them. So believe me. Because they use reliance upon authority. And then they use fear-mongering. That's what that Calgary was. Oh, the tooth decay's gone up. It's been a crisis because they stopped putting fluoride. The children's teeth are rotting out of their head. You gotta go back. So that's fear-mongering. It's another sales technique. It's not science. It's to appeal to your emotion. Well, science is about numbers. And the numbers don't add up. Tax money, fear-mongering, scientific fraud. And they should be ashamed. So when we talk about the weight of the evidence, 300 studies have found fluoride to be a neurotoxin, both animals and human. 100 animal studies showing that prolonged exposure to varying levels of fluoride caused brain damage. When it started, back in 1945, Harold Hodge claimed that fluoride did not go through the blood-brain barrier or into the placenta. Well, Harold, how did you figure that out? Well, I'm the chief toxicologist on the Manhattan Project. I made the bomb. I'm the head honcho. Trust me. And there's an old video of him that the ADA prepared one time where Harold is over here on a blackboard and he writes, 1 part per million is harmless. Good to know, Harold. Now, what study did you do to find that? It's harmless. Trust me. Won't ever answer the other question. So, in case you didn't know, read the book Plutonium Files. At the same time he was making these pontifications, he murdered 48 people. Oh, he tried to murder 48 people with injections of plutonium, thorium, polonium. Remember the guy in England that the Russians came over and poked with an umbrella that had a little polonium on the end of it, radioactive lead, and he died? Well, Harold knew that would kill him because he took 6 people and injected them with polonium. Were they prisoners? No. Were they minorities? Some of them were. A lot of them were. Were they civilians? All of them were. Were they told? No, none of them were. Where did this happen? Happened in the Strong Memorial Hospital in Rochester, New York. That's a private hospital. But it has a secret. In the basement is the tunnel where Harold Hodge had his office over to the Manhattan Project. And he set up a metabolic ward to find out how radiation killed people. So when you want to rely upon Harold Hodge's sweeping arm, you're relying on a mass murder. 47 people died in that experiment. Number 48 is Mary Connell. Mary Connell weighed 80 pounds at the end of World War II. And, you know, big was beautiful in World War II. I want a big woman. And Mary wanted to get bigger. So she asked her doctor, how come I'm so skinny? And he said, I don't know. They've got a new metabolic ward over here at the Strong Memorial Hospital. Let's go find out. And we'll put her in. And they came in, and they injected her with 184 micrograms of bomb-grade uranium. You might wonder how I know this. It's in her chart. This is at the highest level of the United States government, murdering poor little skinny Mary Connell because they tested her and found out she was perfectly healthy. And Harold Hodge intercepted those studies and said, oh, magnificent, a wonderful, healthy human being. And so he gave her 184 micrograms of uranium, and God reached down and he says, I'm sorry about this, Mary, but you're going to live. And she was sick from that day on. Her chart is now about 5 inches thick because she's been back again and again and again with kidney problems. And 1994, chronic kidney problems, she checked in with her doctor and said, this kidney's really killing me. He said, well, let's do a little radioactive IVP and we'll check out and see how your kidneys are functioning. And they did a little radioactive IVP, and the amount of radiation they gave her for the kidney study is infinitesimal compared to what Harold Hodge had given her some 40 years before, or 30 years, 40, and 50 years. And so she was still so hot in 1995 that she fogged the film. And they said, "My God, you work at the nuclear plant?" And she said, "No, I've been sick since November 20th of 1946. And they said, "Whoa, how do you know?" She said, "I checked into the Strong Memorial Hospital and they ran some tests on me. I never felt right again." And so some clever devil said, "Well, you've lived in Rochester, New York all your life. Let's go to Strong and pull your chart." They'd written what they murdered her with in the chart, as well as 47 other people. And I'm not just making that up. Hazel O'Leary, who was the head of used to be called the Manhattan Project, then became the Atomic Energy Commission, now it's the Energy Department. Under Bill Clinton, Hazel O'Leary, head of the Energy Department, apologized because another lady found that they had murdered 18 people with plutonium. And that Eileen Wellsome wrote a book. It's called The Plutonium Files. And that she was able to dig out, with freedom of information, they kept redacting stuff and holding it out, and then she, being a good reporter, she just kept digging and kept digging and kept digging. One report on Alamos said the rat studies at Alamos compare favorably with the human, what was it, Stanford 1? Well, Cal 1, California 1. And Cal 1 was a painter, and that they thought he was dying of cancer, so they injected him with plutonium. Well, he had an ulcer, and he didn't die for quite a while, and they paid him to collect his stool to watch the plutonium go through him. She identified 16 of the 18 people that were murdered by that project. And it got to be such a big stink that they decided that they needed to apologize. And they came and they had a nice meeting with Mary Connell, who was the one that didn't die, and they apologized. And the reporter rushes up to Mary at the end of the meeting and says, "Miss Connell, how do you feel? Are you satisfied now that that the Energy Department has apologized for this tragedy?" And she said, "Well, not really." She said, "We know that there were 48, and they've apologized to 17. They haven't really come clean, have they? Because how come we don't know who all those other people are? The murderers won't tell us. They have it in their records. They redact it. They know who they are. Well, why would you do that? Well, you might complain. That's what happens in a democracy sometimes. If you don't do like Nicaragua or Mexico and just disappear, you come around with a radioactive study showing that you're hot with stuff that nobody on the planet had access to in 1945, except the Manhattan Project. So that's the genesis of our fluoridation program. How did I get off on that? Because you have to go back and look how it began. It began as a mechanism of disposal of hydrofluorosilicic acid. Well, how can you tell it had to be the Manhattan Project? Well, where do hydrofluorosilic acid come from? Only one thing. In 1945, they used limestone to extract uranium to make a bomb that blows up. And they got hydrofluorosilicic acid left over. And they have gypsum left over, and they have phosphate left over. Well, what did they do with the gypsum and the phosphate? Well, they told the farmers the phosphate was good for the plants, so now we have great big tomatoes that taste like wood, because it makes the plant thirsty and it sucks up more water. So you have watery tomatoes that are tasteless. What do we do with this plaster of Paris, the gypsum? What are we going to do with that? Oh, let's put paper on either side of it and build houses out of it. What do you think? Oh, well, that's good. We can do that. It used to be they had radioactive plaster for a while, and then they got a little static for that, and so they take the radioactivity out of it. But they don't take it out of the water treatment chemicals, because Oh, it's so little after we dilute it with, for every gallon of hydrofluorosilicic acid, we'll put in 180,000 gallons of good water. And so it's below our detectable level. Well, I don't care. If I had a marble and I got over here and I threw the marble in there, I would know the marble was in there, wouldn't I? I don't care if you can find it. It's in there. I saw you throw it in there. So they're throwing in there enough arsenic to cause another cancer every 15,000 people. Have we had a tremendous increase in cancer since 1945? Uh-huh. So is that because of the arsenic in the fluoridation chemical or the fluoride? I don't know. I don't care. I want water in my water. Just leave your chemicals out. And, damage to the brain, lower intelligence, 45 animals, impaired capacity to learn, remember, what day is it, where am I? Fetal brain development, milligram per liter of the maternal urinary fluoride during prenatal development, decrease in the full-scale IQ of 4.5, pretty close. 6 to 4.5, we're in the same ballpark. Bashish, higher symptoms of ADHD. Do we have any children with that? Yes, we have. Now we have special education because we've damaged so many children. We can't just turn them loose on the street because they become homeless and beg money from us. So let's put them in a warehouse. Lower skulls, cognitive function, offspring, underactive thyroid. Oh, by the way, I forgot to mention, fluoride kills thyroid. What happens if you kill thyroid? People end up big and fat. Look like America today. I've never seen so many fat people in Oshkosh, Wisconsin. I flew back there to a fly-in, and I'm in California, and the girls in California do work at looking good. I mean, that's the thing. I have never seen so many big people as Oshkosh, and that they flew in from all over. There were 30,000 airplanes, and people flew in with about 50,000 people. And the average weight was about 250. That ain't right. You could have gone to Oshkosh in 1945, and there wouldn't be anybody over 200. So what happens if you kill the thyroid? You lower the IQ. It used to be called cretinism. Well, that's bad because you're calling that person a cretin. So we have to say it's neurological impairment. So if you lower the thyroid function, you get neurological impairment. Dummies. And they don't digest food. The thyroid controls how fast your cells burn food. So you end up getting bigger and bigger. Now, I don't eat any more than that person right there. But I'm getting bigger all the time. Well, that's because your thyroid is damaged. What else damages the thyroid? Oh, your other favorite material, mercury. It accumulates in the posterior pituitary back here, which is the camel driver. It's in the back of the pituitary telling everything else forward what to do. And if you do autopsies of dentists, dental personnel, you find enormous amounts in the nucleus basalis of Maynard and the posterior pituitary. So anyway, let's see, thyroid gland and depressive behavior in rats. Oh, the rats just can't take fluoride like we can. So I prepared some years ago this little test, and I want you to follow along with me and put a check mark on each one of these things that you have been told in school. So did anybody in school ever tell you that fluoride was an essential ingredient to oral health? An essential mineral. The definition of an essential mineral is determined only by one agency in the United States, and it's not the ADA, and it's not the FDA. Oh, actually it is the FDA. The FDA has said essential means that you can create a deficiency. So if you take away vitamin B, you get beriberi, and you take away vitamin C, you get scurvy, you take away fluoride, you get healthy. Well, it's really hard to call that an essential nutrient because the lowest level, the animals are the healthiest. So, okay, so is it an essential nutrient? No, it's not. And so the FDA determined that and said, no, it's not. And they published it the way they tell you stuff in the Federal Register. It's not just something made up. You can go look it up on the Federal Register. That's how they make official expressions. And then I always put this in because one of the problems that I've had over the years, trying to get people to move away from toxic substances in their practice, are the dental hygienists. And I don't mean to pick on them. They do a very valuable service. But putting a deadly dose of fluoride on a child's teeth, allegedly to reduce tooth decay, is a crime that they've been taught to do. And they don't want to give it up because they don't have any of the tools to do what their profession is, hygiene, prevention. They can't because they weren't taught that the germs that are causing tooth decay die if you put iodine on them. Fluoride makes them sick, just like it makes the kids sick. Do you ever do a fluoride treatment and have somebody puke? I talked my friend, the chiropractor, Craig Dillman, into having a fluoride treatment back in my fluoride days. And he blew chow in the parking lot. Thank you very much, Dr. Kennedy. And I don't think he stayed as a patient because I was too stupid. I had fluoride when I was a kid, too. I had plenty of cavities for it, too. So William Kennerly died. The autopsy showed he had 3 times as much fluoride in his body when he was dead than it took to kill one kid that size. And he would have been alive today if the hygienist says, oh my God, I let him swallow it. I've got to call 911. Let's do something. They said, no, there's nothing wrong. Your child is just faking it. He's got the flu. It's nothing we did. It's perfectly healthy. You take him home. You go downstairs to the clinic. And she did, and waited and waited and waited. And when the doctor finally got his stethoscope out and heard poor little William Kennerly's heart going blub, dub, blub, he said he's going into cardiac arrest. Gave him a shot of adrenaline right into the heart, transported to the hospital, and he died while they were trying to pump the stuff out of his stomach. They could have done that 2 hours earlier and hit him alive. Don't you think we ought to include that in the dental education? By the way, if some child should accidentally swallow the stuff you just put in his mouth, he's going to die unless you get real quick about getting the stuff out of his body. Start an IV of calcium so it binds it up in the bloodstream before it stops the heart from beating. That's what they die from. Anybody ever in your practice ever die of a heart attack after brushing their teeth? Fluoride in the enamel makes it more resistant to tooth decay. How many people have heard that? Come on, don't lie to me. Come on, the truth will set you free. Come on. All right, everybody here. So, no. The amount of fluoride in the enamel is irrelevant to the amount of tooth decay. And who says that kind of stuff? Let's see if I include, oh yeah, there it is. The Center for Disease Control, the Journal of the American Dental Association. The prevalence of dental caries in a population is not inversely related to the concentration of fluoride in the enamel. That says it doesn't make a bit of difference, in case you wanted to understand English. It don't make no difference nohow. And more isn't any better than none. So why did they tell us it made the enamel harder? They came up like F. Lee Bailey. I read his book, Never Plead Guilty. Because you plead guilty, you admitted that you were the perpetrator. But if you don't plead guilty, F. Lee Bailey, the great attorney that got all the bad people off, would suggest an alternative explanation. Fluoride makes the enamel hard and it's resistant to tooth decay. Well, that sounds plausible, doesn't it? So F. Lee Bailey was able to give the jury a plausible explanation, and he got a lot of people that were really guilty off. So one at a time, these plausible explanations have been shot down. So it doesn't make any difference how much fluoride you got in your enamel. Since it doesn't make the enamel harder, how do it work? And prescription fluoride, or fluoride added to the drinking water, delivers a safe and effective dose of fluoride to everyone. How many people have heard that? Safe and effective, safe and effective, safe and effective. Isn't that a mantra that you've heard at every meeting you've ever gone to about fluoride? Well, where that comes from is the FDA. In order to get a drug approved in the United States of America, you have to first prove that it's safe. And then that's a phase 1 trial. The second trial is a phase 2 trial where you show that it is effective in doing something. So safe and effective is they're essentially saying this drug has been proven to be safe and effective. That's good. Is it? No. The estimated dose to an infant on tap water formula exceeds the dose known to cause harm. That would kind of negate the safe thing, right? The amount in drinking water will deliver different amounts to each user, and thus a concentration cannot be called a dose. The dose of fluoride, you've heard that? The dose of fluoride in the water. It's the dose in the water, but not the dose in the baby, not the dose in the individual. Dose is weight for weight. Remember that from school? You can't talk about dose as parts per million. Dose is ounces per pound, milligrams per kilogram, weight for weight. So when some dentist tries to come up and say, oh, the dose of fluoride in the water, it's not a dose. What if I drink 1 liter of water today and you drank 2? Was the dose the same? No. It's the amount that you drink, weight for weight. The truth is the FDA has never approved any fluoride-containing substance intended to be ingested as a drug to reduce tooth decay. We got that statement from them in 1999, a series of questions that we submitted, the congressional investigation, the second congressional investigation. There needs to be a third one. And they answered the question very clearly. Currently, fluoride is an unapproved drug for which there is no evidence of safety or effectiveness. So when you go to prescribe something like I did for my nieces and nephews, oops, I didn't say I was perfect. Safe and effective. The FDA has demanded pharmaceutical companies stop manufacturing vitamins with fluoride. And that there's a letter, you can Google Kirkman. It's not exactly like Costco, Kirkland, it's Kirkman. And it's the name of a laboratory in Nevada that was selling fluoride drops and tablets. And they said, stop, cease, desist, don't do that no more. It's not an approved drug. There's the letter. You can Google it, read it yourself. If you read it really carefully, there's actually, I call it the never, 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 ever. Is it not FDA approved? Fluoride's not an approved drug, not shown to be safe, not shown to be effective systemically, and lowest concentration approved for topical application is 1,000 parts per million. The liars now like to say, well, fluoride in the water delivers a topical application of fluoride. And you know, if you were listening, okay, it made the enamel harder. That ain't true. You have to swallow it to get the benefit. Well, that ain't true. And so now they're saying, well, we made the water so toxic that if it splashes on your teeth, the little germs go away. Magic, that's what that is. I believe in magic. But the FDA, who actually insists on things like studies, the lowest level they've approved is 1,000 parts per million. You can find 500 parts per million in Canada. So Canada may know more about it than I do. But in the US, 1,000. Toothpaste, never in children under the age of 6. So how about the child? They're not supposed to have a drink of water until they're 6. Only allows additional dosage information in children 3 to under 14. So they are saying that they have already regulated this so that you can't put it in the water. But they don't get involved politically because you'll get called names. And I hope you don't mind people calling you names. I had 2 brothers, both of them older than me. My nickname is Runty or Punk. So names don't hurt me anymore. They used to irritate me. Products are indicated, and these products all indicate for use down to 6 months. So they were being like the dentist. Oh, at 6 months you can give it to the kiddies. I was at Norfolk, Nebraska. I now remember where it was. We had a nice debate. And that and what they do is the dental societies call all the dentists in from all the surrounding areas, so they can kind of pack the room full of dentists who believe what they were taught in school. Creighton is one of the big schools in Nebraska. And so the hygienist got up there and she was saying, you know, I have 3 daughters and none of them have any cavities at all. And I'm sure it's the fluoride, it's the fluoride, it's the fluoride. And Michael Weasley got up and he said, well, see, another example of the great benefits of fluoride. And I got up and I said, did any of your children have neurological impairment? And she turned white and sat down. Huh. So at the end of the meeting, her husband, the dentist, came up and he said, what do you mean by neurological impairment? And I said, you know, like not right in the head. I'm from Kansas. We talk English. And he said, well, she's got Down syndrome. I said, oh, that's a different deal. Your wife was 21 at the time, right? He said, yeah. Albert Schatz did a study. Albert Schatz is the guy that discovered streptomycin, that turned tuberculosis in the first half of the last century was the same as AIDS. You get tuberculosis, you're going to die. Kiss your ass goodbye. He's done. No more. And then Albert Schatz discovered streptomycin. And his graduate professor stole it and got a Nobel Prize for it. What came out a few years ago was they found Dr. Schatz always said, that's not right. He'd hidden his notebooks that proved unequivocally that he alone had discovered streptomycin in the library, that the professor had hidden them so that he could get the Nobel Prize. But one of his other studies was fluoride, where he went into villages in Chile where they had begun to fluoridate some areas and not other areas, and examined and collected data. Chile does not allow abortions. If you don't allow abortions, then children that have a chromosome abnormality that causes Downs get born, and you can see that they have Mongolianism, and it's a failure of all of the chromosomes to cross over. You can cause this in cell culture with fluoride. It's not like it's a magic thing. It's a terrible poison. And he showed that there was a tremendous increase, not in Down syndrome in older mothers, but in young mothers. Young women never had Down babies until now. And now they do amniocentesis and pull it out and throw it in the trash. Oh, another bad one. Well, why don't we quit causing it? Why don't we figure out why the chromosomes don't move across properly in a young woman? Well, that's exactly what they found, was that you cause an abnormality of the chromosomes of human beings by exposing them to fluoride. And that's what that dentist discovered belatedly, was that he said, I gave my wife fluoride tablets during her pregnancy. Oops. Well, Norfolk said, let's not put that in our water. What do you say? And fluoride tablets is not a dosage that's permissible, says the FDA. So if you prescribe fluoride tablets, like I did, why is it not permissible? Because if it only works topically, what happens with a pill? That's a systemic dose. It goes in your stomach. You don't have any teeth in your stomach. Kennedys do. We just eat our food whole and we chew it in the stomach. But other than that, there's no teeth there. Never in children under age 3, and only after being prescribed by a doctor. What's the doctor that prescribed the fluoride in the water here in Indianapolis? Did they examine you? Can you prescribe something for somebody you've never met? I don't think so. Unapproved new drug, misbranding violations, conclusions, because there's no evidence of drug effectiveness as prescribed, recommended, or suggested. They said that in 1975. Did you see that in dental school? Everybody here was in dental school before or after 75. So how come the professors didn't tell us that? It certainly doesn't support their point of view, does it? Well, who is the king in your dental school? It's the kings that are made kings by money flowing to the school to study fluoride. Hardy Lambach was the advocate for fluoridation in Canada and had grants galore until he determined that there's no reason to systemically expose anybody to fluoride. There went the grants. Boop. Money makes kings in universities. So we can distort the education that you receive by paying them large amounts of money. Once added here's the other lie. Fluoride out of the drinking water comes out in the saliva and hardens the enamel and reduces tooth decay. Well, let's see. How much fluoride, if I swallow the fluoride, how much goes circling around and comes out in my saliva? About the same as the water? No, about the same as breast milk. The minimal amount, says John Featherstone, Journal of the American Dental Association. It's too low to show any impact at all. So you can poison the mother to death with fluoride, and it doesn't come out in their breast milk. You can starve her for iodine, and if there's anywhere in her body iodine's present, the breast will scavenge iodine from that body and give it to the baby, because it's looking for the next generation. Iodine's the antidote to fluoride poisoning. So children who have access to fluoridated drinking water have 40% fewer cavities than those who do not. So you got a study showing that? No, we have an opinion on that. Blinded studies show that there's no statistically significant difference. Poor children have more decay than rich children. And is that because mother wags her finger and says, go in and brush your teeth? Could be. Little contemporary evidence that met the reviewer's criteria for inclusion. Cochrane review. They still concluded that fluoridation was a good idea. That's a political conclusion. If you're supposed to be doing a scientific review and you can't find any contemporary evidence that met the reviewer's criteria, which is broad-based blinded, why do you come up with this other conclusion? Well, we would have to change the paradigm, and we certainly don't want to do that. Those paradigms are so hard to change. Adults benefit from systemic fluoride. So they threw this in recently, about 20 years ago, because some of the old folks were saying, well, why do I need to drink that stuff? I've got dentures. I don't want any chemicals in my water supply. Well, it's really good because it's going to reduce your risk of hip fracture. Oh, well, okay. How about your root decay? Yeah, oh, good. False. National Academy of Science, National Research Council, 2006, identified increased risk. Whatever's bad, they will come out and say it's good. I don't care what it is, whether it's mercury. There's actually a study that they did in the Seychelles that poorly controlled. The Seychelles is a bus stop on the way between India and Africa, and they said, oh, the IQ was better on the kids that had more amalgams. Oh, so mercury's good for brains. So whatever science shows is bad, the liars will come back with a phony baloney study and say it's good. And so it's not hard to understand why the public is confused. Because this scientist said this scientist said that. So you can become an anti-fluoridationist, and what I am is a safe water advocate. Because if the water's not safe for a baby, I don't want it in the city tap water. So I'm a safe water advocate. They don't call me that. They call me an anti-fluoridationist. So you can be called an anti-mercury person, or you could be a safe dentistry person. So choose your label. And when somebody comes after you with a slur or a name calling or something like that, look and see where they're coming from. Ignorance? Probably. Prejudice? Yeah, for sure. Lack of training? Probably. Straighten them out. I'm a safe water advocate. So the addies typically used in water fluoridation are pharmaceutically pure and free of any kind of contamination that may cause unintended harm or lower the quality of the drinking water. I guess you guys know the answer to that. The additives are from Harold Hodges, manufacturing of the bomb, and that they makes the water exceed the MCLG, maximum contaminant level goal. Understand there's two standards for water. One is enforceable by law, one is enforceable by intelligence. So MCL is the maximum they can sell it. So if you have an MCL for chlorine in the water supply, for example, it's 300, I think, parts per million. And so when you turn the faucet on, like in New Orleans, some hot areas of the United States have lots of trouble with bacteria growing in the water. So when you turn the faucet on in a hot community, you can smell the chlorine coming out of the water. And that was linked to lung cancer, actually. And so they put ammoniated chlorine so it stays in the water so it doesn't smell like chlorine anymore. But that's the MCL. Nobody wants to go around drinking 300 parts per million chlorine, do you? I mean, if it'll disinfect the pipe, do you think it's going to disinfect your bowel? So this is a lot of chlorine in the water. water. So that's the MCL. It's a standard based upon the economics of producing water. It's got nothing to do with health. Has not one thing to do with health. It has to do with the cost of producing water that's free of bacterial contamination, MCL. And the MCLG is a scientifically determined endpoint that causes no harm to more than one person in a million. And that all the water with fluoride added to it exceeds the MCLG for arsenic, lead, cadmium. Oh. Systemic fluoride's been approved by the US FDA as a drug suitable for use in children and women during pregnancy. There was a thing on the tube just recently advocating women get fluoride during pregnancy. And prenatal exposure, that was the one I showed you just a minute ago. Neurological impairment, and this is the one from Mexico. Every 1 part per million increase in fluoride in the pregnant woman's urine reduced the kid's IQ 5 to 6 points. She's done a follow-up study, and it found ADHD and other things. Chronic exposure to fluoride in the drinking water at 4 parts per million, a level far above the amount recommended for optimal decay prevention, will never harm anyone. So you got to watch my documentary, China's Battle with Crippling Water, because that ain't true. And that the NRC said it wasn't true. The ADA says 8 parts per million is safe. Well, the NRC doesn't agree with that. Not at all. And they also point out that iodine, a lack of iodine, increases the toxicity of fluoride. If you go to that book, I recommend everybody get a copy of that. It's a government publication. You can get it for a few dollars. But Table 23 shows you that the lack of iodine increases the toxicity of fluoride by a factor of 4. So this is the book. You too can get it. It points out that the MCLG, which is the goal, is not safe to prevent hip fracture, kidney function, neurotoxicity, endocrine dysfunction, carcinogenicity, dental fluorosis. So 60% of the kids in the United States today have some form of dental fluorosis, varying between mild, very mild, to moderate and severe. Severe is where parts of the teeth are missing. I'd say that's kind of severe. Nice new study showing impaired glucose tolerance in humans has been reported in separate studies on fluoride intake at the 0.07 to 0.4 milligrams per kilogram per day. See how they're talking about dose? It's weight per weight over time. Milligrams per kilogram per day. Well, look, 0.07, that ain't very much. That's a little tiny bit. So that's kind of how the dentist always like to talk about, or the ADA lady was saying about mercury. It's just a little tiny bit. Well, a little tiny bit will hurt you a whole lot. The primary function appears to involve inhibition of insulin production. Dental fluorosis is inhibition of an enzyme called MMP20. And what does the MMP20 do? It is essential for growth and development of every human being. So when you see spots on the teeth, you cause spots on the bone, you spots on the kidney, spots on the heart, spots on the brain. You inhibited the normal growth and development of that child, and I think that's a crime. Probably. It'll take a while to get that to court, but you know, it might get there someday. Fluoride impacts the central nervous system, chapter 7 of that nice book. I read it cover to cover several times. Classified as a neurotoxin, just like mercury and lead. Well, says Grangine, untested chemicals. This is the takeaway message right here. Untested chemicals. If you can't prove in a broad-based blinded study of animals or humans that whatever chemical they want to put on your food, whether it's Roundup or whether it's fluoride, is safe, then they shouldn't be allowed to do it. But what they do is they come up with a new chemical every day, and then they deny that it's a problem. Glyphosate is a perfect example, Roundup. They deny, and then it finally took the EU to say it was a carcinogen. And then after 25 years, California, who has a whole separate carcinogen identification committee, they put 8 experts in cancer who said, oh, no problem, no problem, no problem, no problem. Well, if the EU says it's a problem, it probably is. And so they became a Me Too cancer identification Drinking may trigger depression, weight gain. So it's out there. Have you read that? Failure to support community water fluoridation violates the dentist's professional ethical obligations. So they're going to hit you with ethics. Oh, you're not an ethical person because you're not out here supporting our anecdotal point of view. That's false, because your obligation is to tell the truth. And if you don't know the truth, you're graduating from an unethical dental school. That would be all of us, right? So, never been shown to be neurotoxic. Well, I don't think that's right, correct. You have to go to the National Research Council again. The antidote to fluoride overdose is a combination of essential nutrients, vitamin C, iodine, magnesium, and selenium. Is that false or true? Oh, please wake him up. Is that false or true? True. Certainly it is. Why? Iodine, antioxidant. Vitamin C, antioxidant. Magnesium combines with the fluoride, makes it magnesium fluoride, and it's harmless. Selenium is the antidote to carcinogens. Early demonstrations of fluoride effectiveness were reproduced in hundreds of subsequent randomized clinical trials. Not one. Not one. Michael Weasley claimed in one debate that there were 3,000 studies showing safe and effective. And the next time on the radio, he said there were 30,000. Well, the only consistency is the boy who kept the number 3 the same. He's just making the numbers up. You know, where's F. Lee Bailey when you need him? Hey, how come you said it was 3,000 last time? It's 30,000 this time. They never ask him those kind of questions. They say, oh, yeah, 30,000. I'm sure that's good. That's a good number. So the reason others have not been able in the world to reproduce the studies is that Hodge faked them. And there's a book on it by a dentist. I have a PDF copy of the book. He's passed away now. Majority of developed companies use water fluoridation, and this is the other lie. Is that true? No. Is it worldwide? Tooth decay declines have been far greater in countries that implement simple, cost-effective water for something. Water supplementation. Yeah. Supplement would mean you needed it, right? So that's false. Tooth decay has actually dropped faster in countries like Denmark that forbids it, or Norway that forbids it. And the reason is that they have a program of oral hygiene in school. Oh, golly. We have the teacher teaching the children again? Oh, don't they have to go to a dentist to learn how to brush their teeth? Shouldn't we have an 8-year professional teach them how to hold the little brush and wiggle it? They put it in the schools. And so they have benefited from that, an intelligent approach. Here's tooth decay worldwide. Did they ever show you that graph? Can you tell which one of those countries allow fluoride in the water supply and which ones don't? There's a legend someplace that shows you. Let's see. Austria, Denmark, Finland, Netherlands, the blue ones don't have any fluoride in their water supply. And Germany has no fluoride in the water supply because it used to be East Germany and West Germany. And East Germany had fluoride in the water supply because the Russians thought it was really good for the East Germans to drink fluoride if it's not good for the Russians. And then when they combined, they stopped putting fluoride in the water supply. And so Germany's got lots of studies showing that when the Russians leave, tooth decay goes down. Is that because they stopped putting fluoride in the water supply, or is it because the Russians left? I don't know. Be interesting to find out. Adding fluoride to the drinking water has been found morally and ethically by scholars to be benefits and far outweighs any minimal risk, and that is not true. But the ethics of it, look at it. I'm going to deliver to you and your baby and your family and your dog and your cat an unapproved drug that's never been shown safe or effective. But over 300 studies have shown it damages brain tissue. And an equal number of studies showing that there are other pathologies that develop in bone, pancreas, liver, kidneys. And we're not going to tell you it's in the water supply. Go downstairs and ask the bellman if there's fluoride in the water supply of Indianapolis. The vast majority of people don't have a clue. So who gave them informed consent? They didn't. So can you give anybody any treatment without telling them what the benefits and the risks are? You're a doctor, you know, you can't do that. So how could it be morally? So this is people claiming. Our ethics committee said it's perfectly okay. And does anybody on your ethics committee have a conflict of interest? Have they received a grant from the government to promote fluoridation? So look at who's on the ethics committee. F in toothpaste reduces tooth decay by impairing the respiratory system of the germs that ferment carbohydrates so they produce less acid. How many people believe that? Nobody believes that? Oh, come on. Have I intimidated you with all these false answers? Oops. You know, that cagey old professor put a true one in there every now and then. Yeah. It makes the germs sick. I was debating Newbern in Santa Monica, and I misspoke. I said, well, the only reason fluoride works is it makes the germs die. And Newbern jumped out, no, it just makes them sick. He's been paid millions of dollars to study fluoride, and he knows it doesn't kill him. It's not nearly as good at killing germs as iodine. You want to kill a germ? Did your mother put fluoride on a cut, or did she put iodine on a cut? My mother put methylate on a cut. Marisol. I don't think that's a good thing to put on a cut. It disappeared shortly thereafter. Babies can tolerate substantial exposure to fluoride. The first outward visible sign of fluoride overdose during tooth development is dental fluorosis. Today, in fluoridated communities, less than 10% of the children display any sign of minimal dental fluorosis. 60%. 60%, and it went from none. The only people who had dental fluorosis, a guy named McKay, a dentist in Colorado, found a lot of people had brown teeth. And it was called Colorado brown stain in Colorado Springs. And the terrible level of fluoride in the water supply there was 2 parts per million. And it caused their teeth to end up all brown. I had an uncle that was raised in Dighton, Kansas. Dighton is way out in western Kansas. And his teeth were about the same color as an Oxford shoe. And, you know, because he had a cigar tucked right here. And so if you make the teeth porous, they pick up stain. And so Ralph, with a cigar in his teeth, all of his teeth turned a really nice color brown. And you say, oh, golly. So is that resistant to tooth decay? I can tell you, as his dentist, that he had a ton of tooth decay. It did not make his teeth more resistant to tooth decay. And why would it make any difference that he was out in western Kansas, whereas the children in eastern Kansas didn't have dental fluorosis? Is that fluoride comes from a high fluoride rock called the Rocky Mountains. Granite is a high fluoride rock. And the Rocky Mountains, which now are 14,000 to 15,000 feet high, used to be at least 5,000 feet higher. And now they're not quite so high as they used to be. And where did all that rock go? Downwind. And so you will find high fluoride areas on western Kansas, eastern Colorado, on a big plume all the way down through Texas. That's what happened to the Rocky Mountains. Where do they go? They're going to turn into Appalachians in another few million years, or maybe 100 million. So dental fluorosis proves that you poisoned that child during development. We've got 60% of them now. And in summary, it's not an essential nutrient because there's no known deficiency. For example, DNA repair enzyme is 50% inhibited at half a part per million cell cultures. Who wants their DNA repair enzyme to break? Quote number 3, these findings suggest that achieving a caries-free status may have relatively little to do with fluoride intake, while fluorosis is clearly more dependent on fluoride intake. And that's number 2, an enamel has no measurable impact. That's John Featherstone. It's not harder, more resistant. Fluoritic enamel wears more rapidly. It breaks off, chips, picks up stain. It's good for your business, so you can do more laminates, except the fluoride enamel is hard to get anything to bond to. The reason it's not approved as a prescription medication is the clinical trials didn't show a benefit. Contrary to the claims that our profession told us over and over, put somebody in the front room, have them lie to them, they'll believe it, because it's what they had to answer on the questionnaire. Other studies find endocrine disruption, endocrine, thyroid, especially the pineal gland. That means the onset of puberty. This is the table that I wanted you to go get that book so you can read it, because you'll be able to see the difference between how a scientist works and how dentistry works, and that all those little numbers and letters are all those studies that they're basing that conclusion on, is that iodine is protective and that vulnerable subsets include infants that are iodine deficient and levels as low as 0.03 milligrams per kilogram. Wow, 0.03. It's not the one, I seem to remember Harold Hodge told us 1. No. There's a 0. The decimal point keeps going over this way. What's those decimal points? So here's some decimal points. And my old friend Victor Penzer translated, you know, the dentists are very fond of saying, well, you know, dosis solum vinum facit. Dose alone makes the poison. Okay, let's look at the dose in milligrams per kilogram per day. And altered thyroid function, 0.5 milligram. Iodine deficiency, 0.3. TSH, thyroid stimulating hormone, 0.5 milligram. Iodine deficiency, 0.3. Calcitonin, which is going to be linked to your cardiovascular disease, 0.6. Goiter, yada, yada, yada. So there's your graph of those ranges. The 50, 60, 90% claims are a sales gimmick. It's illogical to claim a child does not have access to fluoride, which is ubiquitous. There's no deficiency of fluoride in the world. As you've seen, there's no benefit to anybody, not swallowing it, certainly anyway. Dental fluorosis rates in the United States, this is an earlier study, showed 41%. But understand, to be included in that 41%, you have to have 2 teeth visibly harmed. And if you have 1 tooth that's moderate and 1 tooth that is mild, it's classified as the lesser. So mild becomes the diagnosis, not moderate. If you had 1 tooth that broke off because it was severe and the other tooth was just spotted, it becomes moderate, not severe. So they cheat even the way they calculate what is the injury. More gimmicks claiming the adults also benefit, which is simply made up, untrue. Overall, there was a consensus among the committee that there is scientific evidence that under certain conditions, fluoride can weaken bones and increase the risk of fractures. Did they tell you that? You didn't hear that from the dentist. I think these are repeats. Oop, I got to show you this one. This is the only broad-based blinded study that's ever been done in the United States of 39,000 children in 84 different communities. And that it came out in the NIDR, now called NIDCR, is another word for liar, claimed that it had, water fluoridation had produced wonderful benefits to the children in lowering tooth decay. And they pointed to, like, the TV got bigger and over the time. And so here, John Yamiana sued him for the data, and thanks to Richard Nixon, that we don't have secret studies anymore, because that data was accessible under the Freedom of Information Act, and it showed no significant difference between 0 to 0.3, 0.3 to 0.7, 0.7 to 1.2 or higher. No difference. So when you actually apply a tool of science to the myths that we've been fed in dental school, you find that there seems to be a certain amount of malarkey that has been shared with us in our education. And so the question is, should we ask for our money back? I was talking to Joe Palmer last night as we were spending millions of dollars on dinner, and the question came up as to how can these kids possibly afford to, you know, not charge $1 billion to fix a tooth, because they get out of school with a debt of $500,000. How could you possibly afford to do that? And I don't know. I don't think we should graduate students with a big burden on their back, because they're going to get in that chair and every tooth is going to look like a crown. I've got a boat payment coming up. That looks like a crown to me. So we don't want to belabor the point, but the truth is that we need to rework our profession. Insist that when claims are made, they're supported, and that when we find that claims have been made that are not supported, Everybody here should get their pen and pencil out, or their laptop or their cell phone, and start telling their professors that they've learned something different. And they're particularly concerned about the amount of academic acumen that they had been exposed to in their schooling. Because clearly some of the information that you received, if you believed even one of those things, is somewhat flawed. Because we are being fed a bunch of hooey by people that know better. Because that study I showed you in Calgary would not have happened if she didn't know how to cheat. Same as Harold Hodge. 1 part per million is perfectly safe. You want to believe a mass murderer? Go tell your patients that. Oh, they don't even say that anymore, do they? It's down to 0.7. Oh, golly. Can't you see the lie? Can't you see? It's not going to hurt anybody except a little spotted tooth. That's what we've been fed. And I want you to join me in telling everybody you know that there's a better way to stop tooth decay. You identify the germ that's causing it and kill it. Become a germ hunter. The bug that causes tooth decay is Streptococcus mutans. And it can't stand iodine. It withstands fluoride. So if you really want to practice hide, you measure strep mutans. You know how to do that? 48 hours later, if it turns purple, they got strep mutans. 20% of the children have strep mutans. Well, golly, what happens if you took a rubber cup and some pumice and some iodine and rub around and put it in a water pick and floated it through several times and had them spit in the tube again? Not there. Wait 2 weeks, spit again, not there. Wait 6 weeks, it's back. Oh, okay, so that's how long it takes to grow back. Well, if you have to kill it every 6 weeks, kill it every 6 weeks. But if they'll do a little bit at home with something besides fluoride, they can maybe go 6 months. And you can do it again. So if you really want to prevent tooth decay, you teach the teacher in the schools, insist that hygiene be taught in schools, and you measure strep mutans in every child that comes in your practice and eliminate it. And I thank you very much for your kind attention. I see Griffin's got the hook. We have time for questions.
Dave, yeah, there's time for a couple questions. You ready?
I am.
Hi. How worried are you about resistance, like developing resistance? So over a lifetime, if we're using antimicrobials primarily, so when people are older and their mouth is dry and they have more susceptible to root caries, potentially they have the stronger microbes.
And I'm not concerned at all because there is no resistance to iodine. You're talking about an antibiotic. Bacteria, actually one of our lecturers, is Ann Summers talking at this meeting? Is Ann Summers talking here?
Yes.
Yeah. Well, one of the experts in bacterial resistance is speaking here, and it's Ann Summers. And the way that bacteria develop resistance, they have a gene that they can trade. It's kind of like, say, how would you like to have some resistance to penicillin? Oh, yeah, I'd like that. How about you like to have some resistance to the tetracycline? Oh, yeah, I'd like some of that. So they can trade a gene back and forth across species. And so that's how they get resistance. And you won't find a gene that says you can resist iodine. So our antimicrobials are basically disinfectants. And disinfectants kill the germs by oxidizing them. It eats a hole in them. So yeah, you're not going to develop a resistance to that. There are some germs that are more resistant to certain anti-infective things. They have thicker skins, like tuberculosis. One of the reasons it's such a booger to get rid of, it's got a thick skin. So but it came with that. But the germ you're after is strep mutans, and it doesn't have a very thick skin. Or spirochetes, which are the ones that cause gum disease.
Hi
Kill
there.
bugs.
How much counsel are you giving to your patients on testing their water source? Also involved in that question would be testing the pH balance and then advising on water filtration systems as you're just educating them on fluoride? Or is that something you defer to their functional medicine physician?
I tell everybody not to drink the tap water, and that if they can find a good quality source of an alkaline water, and that I have all the equipment necessary to test. And there's no point in testing the tap water because the city does it about 150 times a year. So you got more data on the tap water than you got anything else. And it's going to come out whatever, and there are reports that lie about the tap water, which we've uncovered because the CDC's website is not correct. It defaults to 0.7. Even if there's no report, it defaults to 0.7. I don't think that's how you collect data, having a default of their optimum level. But anyway, I tell them I like alkaline water, and I tell them I don't like tap water. You could take the fluoride out of the discussion, and there's just a ton of stuff in tap water you don't want to be drinking anyway. So you need to, you need to make food grade water, not industrial. You couldn't, if you loved split pea soup and you wanted to, oh, everybody should have split pea soup, and you put a big tower up in the middle of the city full of split pea soup, and you ran it down through a bunch of concrete asbestos pipes and out to a house with a bunch of copper pipes, and you came out the faucet and you turned on the kitchen faucet and got a big bowl of split pea soup, it wouldn't be worth drinking. It'd be bad because you can't get food grade quality out of a tower that's 20 miles away through a bunch of asbestos and concrete pipes. So it's a myth that tap water is suitable for drinking. It's a myth that's sold by the water company so that you don't complain. And I agree with it because I don't agree with them lying to you. I think they should say, don't drink the tap water. Because you can't deliver split pea soup that's worth it, and they can't deliver water that's worth drinking. It's too hard to have most of the water go in the toilet or in the shower or wash the car or on the yard and have food quality here. No, that's not logical. You'd spend millions of dollars trying to, and the bacteria would grow in it because it would be so low in chlorine that the germs would grow. Yeah. No, remake your own water. You can make your own water. It's not that hard. I encourage everybody to make good water. Griffin. And that guy, oh, he's got it. Okay.
Yeah, how do you add iodine to the pumice to, have the hygienist use it at the hygiene appointment?
There's lots of ways. You know what proxy brushes are, the little brushes that go in between the teeth. In home care, I often have people dip that in a drop of iodine, poke it in between the teeth, and you say, oh, you get overdose. Just spit it out. Mm-hmm. The anti-cancer therapy that Gerson developed had you taking 3 drops of Lugol's a day. Well, if you put 15 drops and use that in different ways and spit it out, you probably get 3. So, you can use a gob of it and just spit it out. And then you run it in between the teeth with a proxy brush or something like that.
So Lugol's iodine?
Lugol's is a nutrient form of iodine. A lot of people go to the store and they say, I want some iodine, and they end up with povidone. Povidone iodine is iodine with an ammonia group on it. It's not a nutrient. It's a poison. Why is the ammonia? The bacteria think that that's the protein, so they take it in intentionally. It's kind of like gift-wrapped hand grenades, and the bacteria blows up. Boom. Okay. It's really good for disinfecting cuts. It would probably work really nice in the mouth, but it doesn't quit killing if you swallow it. On the other hand, Lugol's much milder, less effective in killing, but it also provides the 2 forms of iodine you need. You need iodine and iodide, and it provides both.
Thank you, Dr. David Kennedy.